Hello and welcome back to the IPA's Looking Forward, a weekly podcast of debate and discussion about politics and ideas. Today I'm in the studio with some social distancing going on, as I'll explain in a minute. Parliament's already adjourned until August, so there won't be any debate in Canberra, but there certainly will be debate here as we try and find our way through all the wicked decisions that our leaders have to make at a national and state level. The debates that we're interested in are, for instance, is this a debate between population health and the economy, or is that a false dichotomy? We also have dueling experts like John Ioannidis, who thinks we need more data, and Nicholas Taleb, who thinks that we should just go hard and go now. Is it flatten the curve for 6 months, or is it a short, sharp shock like some argue? These are some of the debates that we'll be unpacking for your benefit. And also because there are lots of people who are now working from home, our culture picks will go ahead. We look today at the magnificent John Wick series, specifically John Wick 3 with Keanu Reeves, a new Netflix series called The Messiah, which is probably what we need right now, and a Spanish language one called The Platform. And to help us talk about these and work our way through the debates, I have with me, first of all, at least 2 metres away, Andrew Bushnell, Research Fellow at the IPA.
Hey, Scott.
Then, once again, down the line from the IPA bunker, still in isolation, is Dr. Chris Berg from RMIT University. Hello, Chris.
Hi, Scott. Much more than 2 metres away, I have to say.
Yes, well, there are worse places to be than Red Hill.
There are.
Beaches are much less crowded than Bondi. Very good.
If I was legally allowed to visit them, you mean?
Yes. So, Chris, in isolation, you have had time to read everything that's been going on. Start us off, please.
Well, yeah. So, like everybody on the planet, I'm consuming a massive amount of content about the coronavirus. But I thought that we should start this conversation the way you framed it as well, which is the debate of the moment. And partly this is a debate that has kicked off because Donald Trump has been talking about it quite prominently. But it's obviously we have now shut down our economies in order to prevent the spread of this virus. The decision has been made very, very rapidly and uniformly, almost across the entire world. The consequences of shutting down an economy are going to be extraordinary. We're not just talking about a recession anymore. We're talking about potentially a depression. And the debate that's going on right now is, have we made the right decision? Is the trade-off worth it? I thought, Andrew, you've been thinking a lot about what this tells you about our value systems and the way we think about trade-offs between the economy, between public health and population health, and I'd be interested in your views initially. Obviously, I've got my own, but what's your perspective, Andrew?
I think the phrase that Scott used before, that it's a false dichotomy to choose between public health and the economy, is an important way of thinking about it. I know that the Prime Minister last night said something along the lines of, we face 2 crises and lives are at stake in both. The important thing to understand here is that when we talk about the economy, we don't have some abstract concern for, the system of creation and exchange of value or whatever else you want, however you want to define it. What we care about is how individuals and families live their lives, how they prosper, flourish in this world. And I would say that of those 2 crises, we can denominate them, if you like, in the same units. So what you'll hear from people who think that it is somehow inappropriate to talk about economic matters is that, well, on one hand, we're talking about lives, and on the other hand, we're talking only about money. But this isn't exactly true. You can think about the impending economic crisis in terms of lives as well. Of the 2 crises, it's impossible to rank them. This is the thing that is really important. There is a non-zero probability of both, and you can't say which is more likely, and you can't say which is more severe. There simply is no data. You're operating entirely in the dark. We have to think about it in terms of operating under uncertainty and taking precaution against both. That's the trade-off, and that's what makes it such a gnarly problem. And it gets worse when you think that the actions you take against one crisis might beget the other crisis. So it's actually an extremely complex problem because the uncertainty is so abundant.
Yeah, and I'd like to just flag, you mentioned the word, decision-making under uncertainty and risk, and I would like to come back to that. But perhaps while we're still framing this, Chris, when you say we shut down the economies, I don't think we have. Well, certainly in Australia and certainly not in the United States, I think there is a debate going on right across the world, and certainly in the English-speaking world, which we're closest to. And if we think about it as a continuum, you might perhaps even put New Zealand up one end of that continuum, where I'm not sure whether they're described as stage 3 or stage 4 restrictions, but the New Zealand government's essentially, put the dial up to 11 right now, and all sorts of consequences flow from that. In the UK, Boris Johnson started off with the dial on 3, and now it's gone to about 8. So they've started to shut down, say, retail outlets, not just cafes and restaurants, but things like retail stores. We haven't gone that far in Australia. You can still buy your electronics. You can still go to JB Hi-Fi if you like. We haven't yet had a mandatory closing of offices. So,
but this is, yeah.
So I think these are live questions. That's why we're debating them.
No, and this is absolutely right. But the pessimist in me thinks that you can't just do a staged shutdown of an economy. An economy is, or an economic system, or a social system. They are so deeply intertwined. You can't just say, well, offices are closed, but factories get to stay open. You can't just say retail can stay open, but they can only do a delivery. But of course, the offices are closed. Maybe the warehouses are closed. Everything is so tied together, and we're talking in such broad brushes. And yes, you're right that there's a lot of distinction between, stage 1 shutdown and stage 10 shutdown, such as they are.
I totally agree. I'm just making the point that we actually haven't taken that plunge in Australia, and I actually think this, and again we'll come to it, this is partly the debate that seems to be playing out between Scott Morrison and perhaps leading the pack on the go even harder side of it is Daniel Andrews from Victoria. But no, we're not actually there yet. We haven't closed.
But going to Andrew's point, these are decisions that are being made with no information whatsoever. So we actually don't know. So National Cabinet sat last night, and they came out with so we're recording this on Wednesday, so they sat on Tuesday night, and Scott Morrison came up with a new range of rules and restrictions, and it was quite obvious in the National Cabinet. They just sat through a bunch of scenarios and thinking through different retail outlets and so forth, and decided, these ones are closed, these ones are open, and so forth. We actually have no idea and no information and no data about what the impact of shutting down any given transmission mechanism will actually be. It's not like we know how much slower a virus is going to transmit during the population if we keep beaches open or closed. Those marginal decisions they are making at the moment between, say, stage 1 and stage 10 or stage 30 shutdown, we have no idea how effective that will be.
Yeah, that's right.
Absolutely no idea.
The uncertainty, one of the many uncertainties in all of this is how many people do you have to take out of circulation to break the chains of transmission? So if you think about it, I saw a nice little depiction of this on Twitter. If you think about it like a family tree, you have one infected person and it branches out from there to different, infecting different people and those people again. A nice illustration, I think, of exponentiality, which is something that I think most people in their everyday lives don't encounter all the time. So it needs to be visualised. How many of those people in that once you have those branches, how many of those people do you have to take out before it stops branching out in a way that's catastrophic? And there's actually no way to calculate that. And I thought the response to the Prime Minister's press conference, I should say we're recording this on Wednesday, so I'm talking about the Tuesday press conference.
Not the Wednesday, the Thursday, Friday.
Yeah, not
Saturday,
the
press conference.
So I'm talking about the Tuesday press conference, and one of the responses to that was, well, why is it that weddings are banned unless there's only 3 people, but you can have a classroom with 30 kids and things like that? And that the point
or
is,
a funeral with 10,
or a funeral with 10. And so if you look at it like that, on one level, it's arbitrary, but on another level, it's about taking people out of circulation. How many weddings are going to go ahead with only 3 people? How many funerals are going to? How many funerals would have had more than 10 people? These kinds of things, and of course, and then how critical are those different events? So there is a reason to treat them discreetly, because the goal is basically to take as many people out of circulation as you need without throwing the entire economy and indeed society out of whack. So I think the operating under uncertainty here, this idea that we simply don't know what it's going to take, suggests that there will be and continue to be a range of measures that are essentially ad hoc as the government, as new data comes in, as people's behaviour, we start to observe people's behaviour in response to different rules. The institutional environment will have to evolve rapidly, and there will be an element of ad hoc, but it's all in service of this one goal, which is disrupting the transmission of the virus.
Yeah, so this.
I'd like to. Sorry to interrupt. I'd like to drill down a little bit on the idea that there's trade-offs here, because I think and Andrew, you're absolutely right that the economy isn't just some separate thing that just sits in a corner for a while. It is also a driver of health. It is also a driver of the social lives that we're all missing at the moment. But I think you take it. Imagine if the government hadn't gone to the full shutdown or whatever variation of shutdown that it's gone for. I think we would still be facing massive economic dislocation and disruption regardless. Because even if the government said, as Boris Johnson did for a short amount of time, that we're going to let this go through we're going to let the virus travel through the society, we would be shutting down the economy just out of fear. We as individuals, we as the private sector.
Yeah, I think that's right.
We would all be working from home.
Yeah,
and we would be doing that without that sort of leadership, and with almost no reason to believe that it would be effective. We would just be doing it from fear.
Yeah, well, that's right. There's the external factors, and then there's the things that governments are doing in response, which are throwing sort of further sand in the gearbox. But the challenge to this argument, though, that we have no information. I'm not sure we have no information, but we have uncertain data, and we're relying very much on models. We talked a little bit last week about this Imperial College study, which has attained the status of Holy Writ in Britain and seemingly left Boris Johnson with nowhere to go at all because it came from experts. The challenge to that came from Professor John Ioannidis, who's made a name for himself over the last decade, talking about the general crisis in replication in science and the amount of junk papers that circulate, and just because it's peer reviewed doesn't mean it's right, and particularly in medical fields. And he came out with a paper where he said this is case in point. These are models with highly uncertain data plugged in at the start, and then he got slapped down by someone who I certainly listened to very closely, which is the mathematician Nassim Nicholas Taleb, who just said, no, this is classic fat-tailed risk. You don't have the luxury of waiting for uncertainty to resolve itself, because the scenario being painted of exponential growth in infections is such that you have to act, and you have to act early. And the he claims, and this is this is what I'd like to test. He claims that the downsides of acting early are not great enough to dissuade you from doing so. You should just go for it. And he, in his inimitable style, referred to Ioannidis as a classic intellectual yet idiot, sitting in his ivory tower, not understanding that real people have to make real decisions now, not later.
Well, for Taleb, the point is that there's the system itself is at risk. What you're betting is everything, and if the stakes are that high, you should probably walk away from the table if you can. But what I think Taleb perhaps when he jumped all over this argument is that I think his principle applies just the same way to the uncertainty that we face around the economic collapse. So I think that Chris's point just before is well made, that if we didn't intervene, the economy would have shut down anyway, to some extent. But the logic runs the other way as well, that if the economy collapses, then the healthcare capability of the country collapses as well. And this means that the precautionary principle, as Taleb defines it, actually applies to both cases, and the two cases are related. And this means that we're in a very unhappy position of trying to find a policy response that mitigates against both catastrophes, or the twin catastrophe, because they're related. And that's why the emerging consensus, now of course this could change any moment, any time.
Exactly.
But it seems like
on Wednesday.
Yeah, but on Wednesday, as of Wednesday, it seems like governments are inching towards the idea that the flattening the curve period, the shutdown, and that's what the shutdown is about reducing or extending the period over which people are ill, such that it doesn't overwhelm at any one point the healthcare capability of the country. The emerging decisions of government seem to be that this period has to be discrete. There's a dispute about how long it will be. On one pole, you have President Trump, who has seemingly lost patience already, and he wants the economy to be back up and running in the United States by Easter, he said today. On the other hand, probably the other pole is if you discount speculation from our own government about a 6-month period, the Danish government's very strong intervention, which involves essentially spending 13% of GDP in a 3-month window, that gives you probably the other pole. That's everything. That's throwing the kitchen sink at it for 3 months. So somewhere in that window, two weeks to 3 months, that's the shutdown. We shut down for that period, and we think about the cost of that as buying time. That block of time is something that we are buying, and in that period, we try and scale up our capability of treating people, identifying at-risk groups, isolating people who have the disease, finding out who's immune.
Millions of test kits.
Millions and millions of test kits. All of these things that we know we can't scale up instantly. We need to buy a block of time to scale them up, and that's what we're trying to do. But it is a block of time. It's not indefinite, because at a certain point, this other catastrophe, the twin catastrophe, the economic collapse, that will itself also kill people, it has to be mitigated as well.
No, that's absolutely right. And so we're all familiar with this flattening the curve graph that was so common a couple of weeks ago, where it's got the hard spike versus the flatter one. I don't think that's the way we should be thinking about this. We should be expecting, if what the epidemiologists suggest is correct, we should be expecting that the vast majority of the population will get this in a very short period of time. And what we are doing is we are delaying the onset of that sharp moment. There is nothing the government shouldn't do to spin up larger hospitals, to spin up more medical students, to spin up testing kits, to spin up masks, everything like that, so that all this incredible cost that we have levied on the hospitality sector, that we have levied on the services economy, has actually bought us something. Yeah. And what I'm worried about when you hear Scott Morrison speak, or when you hear Daniel Andrews speak, or any of the other premiers and chief ministers, we're hearing a lot about the shutdown. And I understand that's a message that needs to be communicated to us, the public, but we are not hearing a lot about the massive amount of work that needs to be done in the healthcare sector.
I think that's because, so if you think about it, there's actually two government policies. They've talked a lot about flattening the curve when they look at this chart, and that's because that's the thing, that because it's essentially an omission, it's a negative thing, it's don't do anything, it scales up really easily, and people can do it themselves right now. So that's the message. But if you look at the chart, of course, the goal of bending the curve, flattening the curve, is to get it to drop below a dotted line that runs horizontally across the chart. That line represents the healthcare capability, the capacity of the system.
Specifically the number of ICU beds.
And exactly. And at the same time that they are telling us to stay home, they are, or they're supposed to be, trying to raise that line. That horizontal line should, over time, have some kind of upward gradient.
But that's the graph that we're not being shown, isn't it?
Yeah, that's because it requires positive things that don't materialise out of thin air, and there's no way of predicting. There's no way of predicting how that capability can be improved.
Oh, I think in fairness, there would be numbers being supplied to government. I think Scott Morrison, if he said, "Give me a number for how many ICU beds we will have in a month's time with all the measures that we're taking," that's a number that they can actually
I think
produce.
It would mostly be. I think it would mostly be made up, and I think that they have to plan for the worst case scenario, which is the worst case scenario is actually that dotted line has a downward gradient.
The services
because the services in the hospitals get worse as we've seen. I think I saw a statistic. Of course, always be wary of things that you come across on the internet, but I think 20% of doctors in Italy or in Lombardy have contracted
the disaster. Chris, I do want to challenge though that what you're saying, that flattening the curve is still the consensus policy of governments. I've spent a few days, and I actually think there's a subterranean sort of battle against that which is going on, and I'm disturbed that it's not more out in the open. And I commend the science journalist and blogger JoNova for bringing it to the surface. She happens to be a proponent of a counter view. And she's distilled the essence of this, because I see references to it all over the place. This idea of but this is grounded not in economics. This is not about population health versus economics. This is grounded in epidemiology, and it's simply the idea that in order to short circuit the classic exponential curve, you must absolutely shut it down right at the start, isolate the virus literally, so that there is no transmission outside of a designated region. If someone's got it in Box Hill or Mossman, it stays in Box Hill or Mossman. So if you go to JoNova's blog, she's got contrasting charts. So instead of a flattening the curve, it's actually like a much a shorter duration, more like 7 or 8 weeks, say, and
that's the suppression strategy.
No. I disagree. I think suppression is a word that you can still use in a flattening the curve, as Andrew said. It's scalable. We every day we add more and more suppression measures. Whereas what JoNova is saying is this won't isolate the virus. This won't break the cycle. We must do more right now. This is an argument for a total shutdown strategy, and so this is people who see themselves on the side of the angels, because they're saying we can't stand 6 months of this. And then I see Trump in some ways as being outside both debates. He's saying we can't stand 6 months of this, and but he seems less in
2 weeks of this.
But he, and also, sorry, I just want to lay it out because I think it's a really, really important debate. The other thing that, and having laid it out, I'll then critique it. The thing, and I have a lot of respect for JoNova, she does terrific work, but the thing it doesn't take into account is all of those things that Andrew talked about, which is not only will we have more ICU beds, we will have more options for treating this disease in 3 months. Preventative and in terms of palliative care. There's all sorts of things taking place all over the world, and I'm a little bit Trumpist in that regard. Trump, maybe he's oversold it, but he's right. There's the brightest minds on the planet are actually working on this.
I'm not sure we can bank on that. I mean, this is the thing, and this is my inherent pessimism, perhaps. But I'm not sure that when we think about it now, what we should do at this time t. I'm not sure that we can bank on time t plus 10 or whatever, t plus x, the knowledge being higher, the capability being higher. There's countervailing problems with that, countervailing uncertainties. That is mutations in the disease, the availability of equipment and drugs, false results, false positives for different treatments.
Just the downsides, the unpredictable downsides of the economic shutdown.
My view is that the government is right in the sense when you come back to this flattening the curve thing, which I've been pondering since I first saw it, because I think it says one thing very clearly, and then you have to really think about it to understand exactly what it's communicating. But I think the government is right to assume that dotted line, that capability line, will be steady, because it can't guarantee that it will have an upward gradient. There's no robust set of reasons for thinking that it will, and we should plan. The other thing that I would say about that as well is that when you think about the curve, no matter what, there's this question of how stretched to the right the graph is, how far into the future we're actually talking. And how long the effects of coronavirus linger. So even if we come up with treatments that work, if the virus is still out there, kind of people going in and out of infection, that's going to have an effect on obviously those people most importantly, but the economy and society around them. And so when we think about our intervention, we need to assume that tail is long, not just fat, but long. Like it just keeps going.
It's a safer assumption. It may not be the case, but yeah, it's a safer assumption.
It's the safer assumption, I think. And I think governments are desperate to err on the side of safety, because not just for their frankly out of self-interest. They know that they will get pinged if they look like they're blasé about this lingering effect. And then I think probably the relevant question for us as well is okay, so what policy interventions help us come out of this period of intense action in such a way that we're robust enough, strong enough to deal with this lingering effect? And then I think not a lot of public debate so far is focused on what the end game is for coronavirus.
Andrew, that brings to mind two things for me. First of all, you talk about how we're going to come out of this, and this is why it's absolutely critical that we start planning now, because I think once these things, it's always easier for a government measure to be put in place than to remove it. We know that. That's why IPA always argues for sunset clauses and time limits and all these sorts of things. And again, Trump actually gets that. We'll find out whether his time horizons are realistic or not, but I actually do commend him for saying we're going to do X, Y, or Z for a period of time, and we need to focus on that, because what we do know, these are wicked decisions, there's terrible balances and weighing up of evidence, but what we do know about decision making, if you don't have the right perspectives in the room around the table, then you're not going to make the right decisions. It's just like in an abstract sense. You just know that. And so the two things that worry me about the decision-making environment that we're in is that the National Cabinet listens to medical advisors, but I'm not sure where the economic perspective comes in. And secondly, to the extent that the elected officials themselves are meant to be proxies for that, they wouldn't have a clue. The political class is less connected to the real economy than it's ever been in our history. If you look at the composition of cabinet and the people who sit around cabinet tables, these are not people who have been drawn, even in the glory days of the ALP governments, for instance, that got us through a couple of wars. These were people who'd worked their way up from the shop floor. Or on the conservative side of politics, it might have been businessmen, farmers, small businessmen, lawyers in commercial practice. And now what we have is a political class. If we're relying on them to be proxies for, the impact on the economy might be X, Y, or Z, I submit that they wouldn't have a clue.
But I also think that we're asking them to do stuff that they have never been really asked to do for a very long time. So, for instance, you think through the average minister. The average minister is, in fact, effectively the CEO of an enormous organisation. And they have to make CEO-style level decisions in the midst of massive crisis. And I think this crisis is going to reveal not just that they're disconnected from the real economy, but they are not very competent people at doing those high-level decisions, making emergency changes. And I think now I don't really intend to go through the cabinet and list them, and some are obviously doing better than others, but I think it reveals that yes, we do need elected politicians, and I'm not at all arguing for technocracy or anything like that, but we need to demand that those elected politicians are also capable people at the jobs that we are asking them to do.
I think they're perfectly capable people, most of them. In that, if you took them out of this context and put them into another context, most of them would be at least suitable for middle management or something. I don't think, apart from one or two.
Speaking as a middle manager, I'm not sure how to take that.
Well, I don't mean to be disparaging towards middle management. But what I mean is that I don't look at our political class and think necessarily, with one or two exceptions, that these are people who, if you believe such measures, have IQs that slip below the average. I think instead what we need is a political class that operates based on, dare I say, values that the rest of us share, ideally, or at the very least can understand. And I think when we look at, when Scott raises this question about the decision making, I have more confidence, I think, in the information such as it is that they're getting. So whatever information there is, I'm pretty sure that they're probably getting it in their briefings. My problem with it is facts don't tell a whole story. Facts need to be interpreted. And on what grounds, given the genesis of this crisis, given how we've dealt with crises previously within my lifetime, on what grounds am I supposed to trust that even with the most reliable, best collected, best aggregated data, that these people will make decisions with my interests at heart? And I think that's the disconnect. We've had this upsurge in populism that we've all spent 3 years debating. Populism is not going away because it's not, as has been framed, a fight against experts. People are perfectly happy to have the chief medical officer come up and talk them through the epidemiology. They're perfectly happy to accept that there are people who can gather this data and can understand what it is saying. They are not convinced that the people who ultimately make the decisions can look at that data and apply common sense, widely shared historical values that we know or have some confidence will produce good outcomes for the rest of us. And I think that's the gap. I think this crisis, like other crises in recent times, reveals that when it comes down to it, we do not trust them, and by extension, we don't trust each other. We're not sharing a set of values that make crises make complex situations intelligible to all of us at the same time.
Should we talk about some of those policy choices then? Because what is interesting about that point, which I agree with Andrew, is that it's not totally clear to me, and maybe I would not make a very good politician in this case. It's not totally clear to me what sort of value-driven decisions you would be making in the middle of a shutdown of the economy. So the reason I ask this is I'm in the unusual position as a libertarian who spent his career complaining that the government does too much, arguing and believing to my core that the government needs to drop everything and fix this. And in those circumstances, and we've had this discussion ourselves, in those circumstances, I think my view is that the government should be doing a lot more to support, not the economy per se, but to support employment and business. Now, that's not I don't feel like I'm driven by my libertarian values in saying that. I'm just certain that there's really no alternative in this scenario.
Yeah,
if we want to spin up the economy afterwards.
No, that makes sense. There's two things I take out of that. First of all, you're saying you're feeling a bit conflicted. The thing that I have been looking for, and I thought of this yesterday, is I would hope that my leaders at least have some cognitive dissonance about this. And I think I have observed that in Scott Morrison at least. So I was greatly disturbed by the example of New Zealand because I felt like this was and constant calls that we must go harder, we must do it now. It just must be done. I would at least hope that even if you then have to take extreme shutdown measures, you at least feel bad about it. This curtailing of individual liberties, putting police out onto the streets, like we've seen in Italy, to arrest people in parks and drag people off in the back of whatever the Italian phrase for divvy van is. I would hope that at least our elected officials would see that as being absolutely in contravention of our, traditions of liberty that go back to Magna Carta. And I'm not overstating it. I mean, this is important. So, and I get some of that. And even when Scott Morrison says, look, you could have some friends over, but not too many and not too often, but I'm not going to be prescriptive about that. That actually reveals someone who doesn't like to just keep coming up with rules all the time. And then the other part of it, though, which you were then sliding into, Chris, is the economics of it, which is exactly right. These things still need to be debated and argued through because it makes a big, big difference whether, as you pointed out, as say Denmark has done, you're giving wage subsidies to maintain the connection of an employee to a business that you hope will be able to get back up and running in a few months, as opposed to just saying, oh, that's all right, they can, just lay them off and they can go down to Centrelink and you've severed that relationship. There is absolutely scope for libertarian thinking there.
Well, I'd like to talk a bit about that because the way it seems that it's evolved, there are two models of job support during this crisis. There's the Australian model, by and large, or the US model, is rely on, supplement, build up, but rely on the existence of your existing unemployment insurance or social security model, so this is what happens if you lose your job because your restaurant had to shut down or your bar had to shut down. Then you apply for Centrelink, and we will raise the level of Centrelink that you're going to get, which is what the government has done. I think they've something like doubled it. But by and large, you're going to get unemployment insurance. The alternative model that Denmark has done, or the UK has done, and a number of other countries have done, is pay firms directly to allow their staff to go home. So keep them employed, have the government assume responsibility for their salary during the period of the crisis.
Or a portion of their salary.
Or a portion of their salary, 90%, 80%, 70%, what have you. And I think in Australia there's a 20% model, but I'm not sure the details about that. Now, thinking through that, I actually think that the latter model, what I'm going to call the Danish model, is actually the more sensible one if we are concerned about what happens when we need to spin the economy up. Even though it's obviously more expensive, even though it obviously has these massive moral hazard problem, I think it's both the kindest and the most moral, but it's also the best place to ensure that the complex economic links between all of us don't suddenly disappear over the next 6 months.
Well, can I jump in here? Because I think I agree, I think, with the conclusion, but I want to walk through it from, you asked, what kind of values-driven decisions are we talking about? I think that is a perfect example of where we need to think about why, for example, we might choose between. Now, it's not binary, either or, but broadly speaking, as you say, direct subsidy to individuals or subsidies to businesses, and there's a trade-off there because we can't do both to the same extent without spending more money than is possible. So we need to have some framework for thinking through which should we prioritise. Now, on the broader theoretical point, and maybe now is not the time for political theory, but then again, maybe it is, given
it's always the time for political theory.
It may be, given the lack of available numbers, as I've been saying. And I think if your theory cannot deal with crises, which are, particularly if your political theory can't deal with crises, which are the reason that the state really exists, then perhaps the theory is inadequate. But leaving that to one side, I come down, I think, on the same side of that, where that priority should lie, and that is with keeping businesses alive. But I don't think that is an economic argument that is reducible to the interests of individuals. I think it actually comes down to the real value of society. If you think about a business, the value that's contained in that business is not just what it sells to its customers and what profit it banks for its owners. It's actually in the working of that business. There's its client relationships, its reputation. There's the knowledge contained within its existing workforce about how the business works. There's efficiencies that have developed over time. All of that kind of knowledge is irreplaceable. If those businesses die, businesses need to be created and then develop that value all over again. Society is similar. It's not just businesses that contain value, knowledge like that. It's all over society. How we live in this world, this country together, that is value that is developed at high cost. It's easy to destroy. It's hard to create. This is, I think, where, to put it in political theory terms, this is where conservatism adds some explanatory value. It's because...
Absolutely.
And it's because these things, these institutions that we associate, perhaps, we associate their justification with, say, another theory. And I'm thinking here of our liberties. We tend to associate them with liberalism, and we tend to associate their justification with that theory. If you look at someone like, say, Peter Hitchens, who's a
hardcore
proper
conservative,
proper high,
suitably pessimistic columnist from the UK.
Conservative. I almost called him a Tory, but he hates the Tories. But a proper conservative, and he said that he thought Alexander Johnson's intervention was too heavy-handed because it went against England's traditional liberties. And for this, he got called a liberal. And he was like, no, I'm not saying I support a theory. What I'm saying is that there are very concrete things that I have always been allowed to do that the government is now telling me I am not allowed to do. And he offered a defence in those terms.
I do think a liberal and a conservative could arrive in a very similar place.
No, and this is I agree with everything that you said.
Beautifully said, Andrew.
Because and this is what worries me. So let's say there's a Australia, American model, and then a Danish-British model. And what worries me is the idea that we are suddenly in, which is you can even freeze an economy for 2 weeks, let alone 6 months. You can even just stop and refund. The damage that's going to cause to those complex social economic networks between not just people working in a company and the knowledge embedded there, but between families, between communities, between my children's scouts organisation, the local Vic kick, the idea that we can pause or freeze and unfreeze an economy is absolutely, is obviously not true. And I think that when we're accounting for the damage from this effort, no matter how much the government tries to counter the costs, those costs are going to be very, very real. Now you've made the point that that's a conservative thing. I don't really think that's a conservative model. That's a model of the world that sees civil society as first and foremost the most important place that we get our value and our relationships from. And the government has decided, rightly or wrongly, probably rightly, to put a pause on civil society.
Yeah, it's a necessary part of conservatism as a theory. It's not a sufficient description. You and I might differ on, say, whether society has an independent existence. I would say that society, unlike the economy, is probably not reducible in any realistic sense to the individuals who constitute it. And I think this has a bunch of different things. You and I might differ on whether there is such a distinction as that between fact and value at all. So there are different things that we could dispute, perhaps. But I think that when it comes down to it, when push has come to shove, we all know that we act first to secure the order within which we make our choices, within which we live with our families, within which, basically within which our lives are made meaningful. We act first for the most basic political good, which is order. And that's why I think is the theoretical conclusion that comes from this. And I'm sure we'll get a chance to go back and forth about that forever.
Well, absolutely. I hope that this podcast has illustrated a couple of things. It shows why debates are important, and even though we must get in behind measures to curb pandemics, it is not unpatriotic to question decisions being made by governments and to look at how decisions are made and what the science is behind it. I think we've established that ideas and values always matter. This idea that in a crisis everything becomes pragmatic is rubbish. And I think, Chris, that was exactly right at the end to remind everyone that the economy, I put out a note to IPA members yesterday. I said some people, those who we might call stupid, think of the economy as something like, a pyramid. It's just there and you can stop adding to it, but, you leave it for 3 months and you come back and it's still there. The economy is a miracle. It's like every day, as Gary Wolfram said to our students at the IPA Academy last year, every day in New York, everybody wakes up, goes down to their shop, and there's bagels there ready for them to buy.
Just not toilet paper.
He said it's a miracle, and the fact that there isn't toilet paper now just shows that the miracles can.
Well, there is toilet paper now. There is toilet paper,
but the chain can be broken, and there is a degree of fragility there, and the idea that you can just start is a nonsense. And so, as I say, whether Trump and those pushing for something shorter are proven to be, whether that's feasible or not, I certainly sympathise with the sentiment.
Let me just give can I just give a quick,
very quickly
before we move to culture picks as well, because there's two parts. We cannot be in a situation that it is viewed by the public or by policymakers that these are things that cannot be debated, and there's far too much in the last week or two of hostility to even discussing the value of these trade-offs. A lot of people are making a lot of big claims about the moral worth of even discussing these things. Even if I agreed with them, there is no way we are getting through this crisis without having a free and open discussion about the options ahead of us so that we can feed those ideas back to the policymakers that have to make those decisions. There's just no way that we're going to get through this crisis without doing that. And the second point is that I think what we've seen in the last 2 days or last week or so is actually not just the fragility, but also the resilience of some of our economic systems, at least. And, I haven't been allowed to go to the supermarket in the last 10 days, but as I understand it, the supply chains are reorientating themselves to supply us much better than they have since the initial surge. That is the optimistic thing, that we have a economic and political system that is actually capable of adaptation, even if it feels like it isn't sometimes.
Yes, isn't it a nice optimistic note to finish on there? Isn't it remarkable what a free society can accomplish?
Yeah. It just takes time. That's the problem. It takes time, and it's scary during the adjustment period.
It is. We have come to that part of the show where we talk books and culture. Andrew, they shot his dog.
Well, exactly. So we're talking here John Wick, right, which is probably the most successful new action film franchise if you leave out the comic book ones and things. It's an action franchise now, 3 movies long. There's a 4th one scheduled to come out next year, assuming that coronavirus gets out of the way of shooting it. Keanu Reeves stars as John Wick, who's a Russian or Eastern European hitman who basically the Russian mafia kills his dog, and he goes on now 3-movie-long killing spree. I tried one day to watch John Wick and count the number of people that he kills in response, and I gave up after about half an hour.
Numbers don't go that high.
these movies, the 3rd one is streaming on Netflix and on Foxtel at the moment, and these are stylish action movies. They're stripped down, minimalist in a way. The storytelling and that's why Keanu Reeves is perfect for it. As I was watching this 3rd one, and I won't dwell on the point too long, noting that the time, but as I was watching the 3rd one, I had this very strange idea come across me, which was that this movie reads like a parody of the rules-based international order. So you have this.
I wonder how many other viewers had that thought, Andrew.
So I was sitting there watching this movie, and as the 3 movies have developed and that the world has been built up around John Wick, it turns out that he is part of this incredibly extensive society of hitmen, such that on every corner of every city that he goes to in the world, there are people there to kill him. It's basically everyone's in this club apparently, but the club has its own rules. It has these hotels that are safe havens where the killers can all go and get a drink.
It has a governing body.
It has a governing body. It's got a bureaucracy. Like in this 3rd one, it's even got the
adjudicator,
like a tele-networking bureaucracy that you can call up and give advice.
I wonder if they're all working from home now.
And so it's got all of these, and the movie, if you watch the 3rd one and just note the amount of times that someone appeals to the rules, and what happens is that the rule gets broken because it doesn't have any real normative basis, because these are killers. They're not engaged in something good. Their rules don't refer to anything other than mere convenience. And it all, there's no reason why John Wick wouldn't break the rules to save himself. And I think this is worth pondering at a time of institutional or near institutional collapse. That what is it in the end that gives these things their force? In the end, as the saying goes, there's no honour among thieves, there's no honour among hitmen, and yet this world takes place amid this incredible rules-based bureaucracy. So
what I want to know, or what I want to see next, is the prequel to the John Wick series, so that they've demonstrated or show how this rules-based system actually builds up, how a group of Westphalian hitmen came together.
No,
Was there
exactly.
some great crisis?
I love thinking about stuff like this. Like one of my all-time favourites is GoldenEye, the Bond film GoldenEye with Pierce Brosnan. Now, the weapon that Sean Bean, the bad guy, has in this is a huge satellite dish that it comes up from under a lake. Now, who?
Yeah, very hard to build.
Can we see the movie about the building of this weapon? Because that is extraordinary. And, of course, parodied in Mike Myers' Austin Powers,
yes.
With the henchman, where you get this cutaway scene of like the wife of a henchman being informed that, no, he's one of the unlucky henchmen that's been killed by the hero. And I love thinking about that. And John Wick is like, if you take, and you probably won't think about this because the action sequences are really interesting, well choreographed. It's quite a stylish series of movies. But if you do just turn on your analytical brain for a moment, this world is actually fascinating.
And you never turn your analytical brain off. Chris, speaking of satellites, we've got 7 minutes till we lose the satellite. So you go now, and then if you have to sign off, I shall. No worries. I shall have mine at the end.
So I have a similarly intellectualized reading of a popular movie. This is the Netflix movie The Platform, which is a Spanish film that was just released, and you'll all be seeing up on your Netflix queues as well. It's a sort of horror sci-fi, and it is a very brutal horror film, so if you're not into that sort of thing, please don't watch it. But the idea is that it's basically a prison that everybody's on a level of the prison, and food comes from the top level 0 to level 1, and everybody eats as much as they can, all the way down hundreds of floors. And the argument is, and it's a sort of Marxian type message in this movie, but the argument is that there's enough food for everyone, but because the people on the upper levels gorge, the people on the lower levels have no food. The trick, though, is that you keep being reassigned and you don't know what level you're going to be reassigned to. So you might wake up on level 30, but a month later, having spent a month on level 30, you're suddenly on level 132 or so forth. Now, the movie is perfectly adequate if you're into really brutal
So that's sort of the John Rawlsian
that's exactly right. So
of ignorance.
This is like a reverse veil of ignorance because you know that you're going to be reassigned. And it's but you don't know where you're going to be reassigned to.
Yeah, it's a collective
action
problem.
The lesson of the whole movie is that Rawls was wrong because everyone acts in their own self-interest, even when they know that they could just as easily be in the bottom. And the conceit of the film, or at least one of the hints of the film, suggests that it's all about will a social order naturally emerge from this? And it turned out it never does. And the people stuck in the prison will never adopt the Rawlsian veil of ignorance.
Well, because they're actual people. Like Rawls abstracts away all the things that make choosing important, which is your personality.
And Andrew, this will be your favourite Marxist movie.
And he abstracts away time. The development of these things over time. I mean, the Rawlsian model is wrong for a host of reasons. So I look forward to watching this one.
But it's I of course challenge the premise because I think there's been a great series.
Because the prison doesn't exist because it's unrealistic.
No, but we're world building here. But I mean, this is there's a lot of work in economics and there's empirical work, of looking at people in and testing them. And there's a book I'm just looking for. I think it's called Humane Economics. And the fallacy was Rawls's fallacy, and it basically assumed one round per game, and
it assumes that you can't exit.
Yeah, that's right. It assumes one round per game, so people will act in their narrow short-term interests. But what you find, and what they do find in laboratory settings, and it's taken a couple of decades to think their way out of Rawls's supposed slam dunk is, given, we don't live in a single round game. We live in, and what this should have proven is that in a multi-round game, you will actually work to establish some rules. And there is a natural reciprocity that people look for in their trade with other humans. So,
in fact, the argument of the movie is that you don't, and you just have to figure out a way to appeal the game setter. So you have to appeal to their moral claims or what have you. But anyway, it's a fun movie to watch if you can stomach the sheer violence of it, and it does raise these interesting questions about political philosophy.
Right. Well, I'm going for a Netflix trifecta today. It's a series called Messiah, which I'm about 8/10 of the way through, and so no risk of big spoilers. But essentially, the premise is that there is this vaguely Middle Eastern-looking guy who turns up in Syria, speaking Arabic, who performs a miracle and attracts a bit of a following in Syria. And you think, okay, where's this going? Is this because it's not even necessarily the second coming, because it's in Syria, and of course he's addressing a group of Muslims. But as the series unfolds, they add layer and layer of complexity. It's actually a very well made show, as my friend Griffo put me onto it. And the acting is good, but they're not recognisable actors, so you don't get thrown by it, because Syria, the ISIS is mixed up in all of this. So at least initially, so the FBI is interested, the CIA is interested, the White House is interested, and over the course of the series, this guy El Masih, as he's dubbed in Arabic, meaning literally the Messiah. He then moves into to Israel, and of course the Israelis have an entirely different set of issues when it comes to someone claiming to be the Messiah or having followers who think that he's the Messiah. And then just to complete the sweep of the religions of Abraham, he then moves to America, into Middle America, into a small church in outback Texas. As the town is about to be destroyed by a tornado. So it's and then there's the reaction of the local preacher there, and he does just enough to make people think that there's miracles. The viewer's left in some doubt. There's the CIA and FBI characters are dealing with their doubts and skepticism. One of them sees it as a global conspiracy to confuse everybody, and the others, who self-described a lapsed Catholic, is perhaps a little bit more interested. So it's there's a few themes in there, but I wouldn't want to overstate it. It's mainly entertainment, created by a guy called Michael Petroni, who did The Book Thief, which is a movie I missed, but apparently made a bit of an impact at the time.
I don't know the movie. I did start watching The Messiah, but it didn't grab me for some reason. But I think, it's again, it's one of these things that's interesting to contemplate in the current moment. How would it be received if someone popped up right now, and there was some credible reason for believing that he had warded off the coronavirus crisis? I think that I would become a follower because
times demand.
Because I've run out of patience, perhaps, with this crisis. I'd like it to be over. But I think you could see the appeal of that. Certainly I could.
Look, this is certainly a time for Pascal's wager, which is, why wouldn't you pray? There's no downside risk there.
It scales easily.
Yeah, pray for deliverance, and the more people doing it, the better. Chris, thanks so much for dialing in from the bunker.
No, thank you. And this has been a fantastic conversation.
Thanks also to Andrew Bushnell.
Thanks, Scott. Thanks, Chris.
Wonderful contribution today. Thanks to Josh and Mitch in the studio. I'm Scott Hargreaves, editor of the IPA Review, and I and Chris and some colleagues will be back next week, come hell or high water, no matter whether it's from home or wherever, with another edition of Looking Forward. Thank you for listening.